Hi, I wanted to talk to you a little about chronic pain management programs. Let me first give you kind of an idea of what a CPM program is. A chronic pain management program usually is one in which patients who have been hurting in chronic pain for 6 months or more uh, come to a facility. They're there all day, they get to clock out for lunch, and half of the day is spent with a licensed counselor, and half the day is usually spent with someone doing physical therapy, often a chiropractic doctor. And on a weekly basis, there's supposed to be a team meeting between the folks who are treating the patient. And usually the team consists of, like I said, licensed practical counselor, a chiropractic doctor, and either a MD or a DO, because often these folks are being given prescription medications, sometimes for pain, sometimes for other issues. And during that meeting, there's supposed to be an exchange, interdisciplinary interchange of ideas to see what's working, what's not working, whatever. The theory behind all this is that someone who is in chronic pain for 6 months or more gets deconditioned and often becomes clinically depressed. Now that sounds fine and dandy insofar as it goes. Where the rubber hits the road is, does it work? Now, what's my expertise for talking about this? Well, I was involved as an active and integral member of a chronic pain management program, and also did work hardening classes, and also did FCEs, functional capacity evaluations, computerized testing, PPEs. So I had, first-hand experience running the meetings, treating the patients, being the one providing the physical therapy for half day, interfacing with the MDDO or the licensed practical counselor. Did we fix anyone with chronic pain? I can't remember doing such a thing. Did it benefit the people who were billing out? Yeah. I don't know how much most of the chronic pain management programs are billing out at this point, but I know that it might not have been unusual for some folks to bill out at $1,600 a day per patient, and typically you would have several patients, or maybe $800 a day, but it's fair to say several $100s a day for maybe a couple of weeks. And of course the main thing is you want to keep authorizing more visits. Now, I'm confused as to why the insurance companies continue paying for these programs, because personally, in my experience, I didn't see that we fixed anything. We certainly, had persons who still had pain at the end. I don't think we fixed depression. I don't think we fixed chronic pain. Why do people have chronic pain? Someone pointed out to me, people have chronic pain because there's a good reason for it. Often it's because they might have fibromyalgia, they might have a blown disc, they're either awaiting surgery or it's not in a surgical case yet, a surgical point yet. And if they have such organic physical problems, I don't think talking to them a half a day and having them do some stretches on a mat are going to fix that. If they're out of a job, their relationship with their wife or a significant other is going down the tubes, they're in pain all the time, they got a good reason to be depressed. There's no light at the end of the tunnel. And you can you can clock out for lunch and make it appear like it's a little job and be there 8 hours a day till the cows come home. And I don't think you're going to fix anybody. And I have questions. These are all questions. I'm not saying that they don't work. It's not my experience that we fixed anybody. And I think that the insurance companies need to take a long, hard look at where they're spending their money on these programs and how these programs are evaluated and what the outcome base is of are they using an outcomes-based approach? Is it a best practices approach? Or is it just something to keep these people occupied and make a lot of money for those folks who have such programs? I don't know. I'm asking the question, but if I was in such a program and I'd been there for 8 visits and I was just still hurting just as bad and I was just as depressed as I was to begin with, you think I'd go back for another 8 or 10 visits? No. You know, Albert Einstein said that doing the same thing over and over and expecting a different result is his idea of insanity. Well, yeah, that is pretty crazy. If a person has been for 8 or 12 or 10 visits to a CPM program and they're still hurting just as bad, they're not any better, they're still depressed, you know, their life is in shambles and there's no light at the end of the tunnel, there's no job waiting for them, think they should go back over and over and do the same thing and, in essence, just make somebody a lot richer? I don't know. I wouldn't do it myself. So I think these are appropriate questions to be asking, since the insurance companies these days are looking so close at everything else. I think they should really examine the tremendous amount of money that's been spent in these programs. I mean, let's say that it's been billed out or paid out or whatever, $1,000 a day per patient. Do you realize that in 2 weeks' time, 10 days, that's 10 grand, and if you've got 10 such patients, that's 100 grand. That's a lot of money. And then what are you going to show for it at the end of those visits? You're going to request more and more and more till you won't get any more. Try to figure out a way of saying, well, they had a bad weekend, so that's why they're not making any progress. Beats me. You know, I mean, if you go to the well, it's dry and nobody pours any water in it, do you need to keep going back over and over to figure out it's a dry well and it ain't going to be full of water? How many times do you have to go back to figure out the person ain't going to get no better? Questions, but they're important questions, and if you're in the insurance industry, look at the available data on that. That's independent data, not generated self-data by the people who have vested interest in keeping money rolling in on these programs, but can you take someone that's depressed and with 8 or 9 levels of pain, run them through an 8 to 10 day where they're rolling on the mat doing exercise and talking to a counselor for half a day, and make them all better, make them cheery and rosy and able to go back and find a job and all that? I haven't seen it. Maybe it happens somewhere. I don't know. Good questions, though. Got to admit that. Have a great day. Bye.